Hi, good morning. I'm Juan Alejo. I'm a pediatric cardiologist from UCLA. And people always wonder, okay, the rest is up. We're talking about smoke and fire. And I mean, cardiologists always think that the heart is kind of the most important organ, but actually we have to admit that they actually depend on all the other organs in order for us to be healthy. So that's why we're coming from. So the question is, I mean, in terms of what we're here, why we're here today, I mean, which patients, my patients are going to be at risk. I mean, all these kids, I mean, maybe the kid with the oxygen, not quite so, but all these kids, I mean, look like happy and healthy kids, but they have one thing in common. They are single ventricle patients. They only have one ventricle, which means that their blood all mixes together. And these are the kids who are especially at risk for, I mean, smoke and fire, and I mean, it's just basically overall air contamination. So, I mean, why? I mean, if you look at this side, far left, or for you, that's a normal heart. The way blood, I mean, it divides the blood into two different streams. I mean, separates the blood. Blood goes to the lungs. It's all that blood is deoxygenated, goes to the lungs, picks up oxygen, comes back to the left side, where the oxygenated blood goes to the body and to all the organs. I mean, especially, I mean, the brain, the liver, the kidneys, all the organs, I mean, the stomach, the intestines, everything that's starving for oxygen, and then it's deoxygenated and returns to the right side. So it's a nice figure of 8. And you can see in the middle is a little bit more clear, like the separation, but to the one most to the left. In the single ventricle patients, all that blood mixes together before it gets pumped out again. So some of that blood goes right back out to the lungs, even though it's already been oxygenated, and some of it is deoxygenated or actually mixed. So you go in with a saturation of 100% and you come out with a net saturation of 75%. So those kids, I mean, do not see a normal, oxygen, even though their lungs, and these kids, presumably all healthy lungs, they're providing complete oxygenation of the blood that goes through them. So, I mean, you look, when you have this kind of single ventricle physiology, the blood mixing in the ventricle, like as I mentioned, it goes in 100% saturated and it comes out somewhere between 70, 75, even after the best palliation and best surgical procedure. And what you see is the child, like at the left, perioral cyanosis. So, I mean, that is what we expect from these cardiac palliations. But there are separate palliations that get them to a point where they're fully saturated. Again, we're making assumptions here. I mean, in all these kids that they have normal lungs. So that's why these are important steps, because patients who do not have normal lungs become non-candidates for further interventions. So this is what happens. This is what you see. The lung on the left, on your left, is a normal, healthy lung. The lung on the right, I mean, this case is a smoker's lung, but this is what happens with fire. This is what happened. That lung is non-functional. That lung does not do gas exchange, does not get rid of the carbon dioxide, does not take in full oxygenation. So basically, any child who has, I mean, actually, obviously, this is for demonstration, for comparison. But if you can, in children who have lungs that are damaged by smoke, I mean, both their lungs are this way. So they do not bring in, their oxygenation, best saturation comes in, let's say, at 85%. So right there, I mean, the minute they start mixing, their own saturation is the 60% range. And how does desaturation, impacts, I mean, development, both, I mean, physical development, intellectual development, and overall just general health. I mean, you're prone more to infections. You'd have your life expectancy diminishes because you're no longer become candidates for subsequent palliations, and your body, as you get bigger, that 65% saturation that you're seeing begins to continually drop, and you're exercise limited. So obviously, it's a huge impact. So, I mean, my goal by being part of this group is that we get to this point where we get kids who can actually get the final palliation with a single ventricle and be able to be normal kids. I mean, as close to normal as you can get. So that's how this smoke and fire, and I mean, again, the atmosphere we live in, this is how this all impacts patients with cardiac disease. So thank you.